This legislation amending the Health Resources Fund Act was debated at some length in second reading and was given a very thorough examination, I understand, before the Standing Committee. And it would therefore seem that there is little value in extended debate on third reading, because it's perfectly clear that the government intends to use its very large majority to push this legislation through Parliament. But I venture to participate in this debate not only because of the impact of the legislation itself, but because of the attitude of mind which it reveals, because of the emphasis which it gives to certain aspects of our national life, and because of the disjointed scale of values, social values, which I think are displayed in this legislation. We should understand that this legislation comes before the House largely as a result of the announcement which was made by the Right Honourable the Prime Minister on national television on August the 1st. The Prime Minister had attended an economic conference, had sailed on the Baltic with Chancellor Schmidt of West Germany, had a holiday in Morocco, and then returned to Canada to do a complete reversal of the government's fiscal policies. Up until that time, he, and particularly his Minister of Finance, had been telling the Canadian people that what we needed was an increase in the effective economic demand, and therefore the Canadian people should save less and spend more. But on August the 1st, the Prime Minister announced to the Canadian people that the government was going to embark upon a program of restraint, and that they would cut, at first statement was $1 billion, and then later this was raised to $2 billion from the estimates which would be passed, it was hoped, by the Parliament of Canada. It's significant, Mr. Speaker, that the Cabinet was called together 10 days later to hear what these cuts in their estimates were going to be, which makes me wonder what has happened to the principle of Cabinet responsibility and Cabinet solidarity. One of the long-standing traditions of the parliamentary system has been that the Prime Minister is primus inter pares, first among equals, but that the decisions which are made are not the decisions of the Prime Minister, but of the Cabinet, and that the Cabinet must collectively accept responsibility for those decisions after due process of consultation and discussion. But not so in the matter of restraint. The Prime Minister made the announcement like the president of a country with a presidential system, and then called together his cabinet ministers merely to hear what decisions had been reached by the Prime Minister himself. I think that's a very serious indictment of the regard which the government has shown for the parliamentary system. There has been growing concern in this country that we are moving step by step toward some type of presidential system, and if ever it was demonstrated, it was shown on August the 1st, when the Prime Minister reversed the fiscal policy without even his Minister of Finance or his other ministers having been consulted or being aware of the decision which had been reached by the Prime Minister himself. I want to suggest that the legislation now before us, dealing with the Health Resources Fund, has three major defects. And I want to deal with them individually. First of all, let me point out what this legislation does. This legislation seeks to end the Health Resources Fund, which was set up in 1966, which has 2 years to run, in which there is over $80 million, which was to be paid out to the provinces to provide certain essential medical and diagnostic facilities. And this was a commitment which was made by the government of Canada to the provinces of this country in 1966 as an inducement to sit down with the federal government and work out a Medicare program. Now, the provinces came in, some of them reluctantly,
Kicking and screaming.
not because they were unwilling to deal with the health problems of the nation, but because some of these provinces had very limited financial resources. And they knew that the moment they had a Medicare program, their diagnostic facilities, their research facilities, their medical and hospital facilities would not be able to cope with the magnitude of the demand for medical and diagnostic services. And their concern was allayed by the fact that the federal government said, you don't need to worry about that problem. We're setting up a fund of $500 million, which will be paid out to you on the basis of your need and as you proceed to improve your health care facilities. And the provinces came in on that understanding. This, Mr. Speaker, was a contract. This was an obligation entered into by the federal government in return for the provincial governments agreeing to enter into a program which they knew would be extremely expensive and represent a great drain upon their financial resources. And now, without any warning, without any consultation, federal government announces in this legislation that the Health Resources Fund is to be closed, no more money will be paid out after any commitments that have been made have been dealt with, and that a fund with $80 million still in it, which really belonged to the provincial governments, will be ended. And the minister herself put this matter very clearly at page 1520 of Hansard for November the 27th, 1978, when she said, "Why put an end to a good fund 2 years before its natural end?" And she answers her own question. She said, "The government of Canada had a difficult decision to make in applying a major traumatic restraint on its own expenditures." Well, Mr. Speaker, it not only had a difficult decision to make, it had to decide whether or not it would break faith with the provincial governments on whose behalf this fund was established. It had to decide whether it was more important to cut some other items in its budget, to clean out some of the waste and the extravagance which have been demonstrated amply in the Auditor General's report year after year, or whether instead this fund would be completely eliminated and the provinces would be left holding the baby, with all the responsibility to carry on their share of a Medicare program, but without the financial support which had been promised to them. My second criticism of this legislation is that it assumes that the purposes and the objectives of the health care programs have been attained. And of course, Mr. Speaker, they haven't. The member for Lambton, Kent, said earlier in this debate that the goals of universal health care have not been realized. That statement is true. That statement is true because we have only covered part of the program to provide the Canadian people with universal health care. Let me just very briefly, Mr. Speaker, make a historical summary of a health care program in this country as it applies over the past 30 odd years. As members know, the first hospital insurance and diagnostic services legislation in Canada was passed in the province of Saskatchewan in 1946.
Here, here.
And came into effect on the 1st of January 1947 and was financed entirely by provincial revenues, despite the fact that in 1945 we had been assured at a federal provincial conference that the federal government was going to come into this program and share the costs on a 50-50 basis. That hospital insurance and diagnostic services program was financed entirely by the provincial government in Saskatchewan until 1958. Now, some members opposite in the course of the second reading said that, of course, hospital insurance for Canada as a whole was introduced by a Liberal government under Prime Minister Saint Laurent. Of course, that's not correct, and I don't attempt to ascribe any idea of misleading when I say that. I think these people are just not familiar with the facts. It is true that in 1956, the Honourable Paul Martin, the Minister of Health, introduced a legislation to provide hospital insurance shared 50-50 between the Government of Canada and the provincial governments.
Provided.
But it had in it a proviso which said that the federal government would only pay 50% of the cost if a majority of the provinces, representing a majority of the population of Canada, agreed to enter the program. Now, that was a fairly safe promise to make, because everyone knew at that time that the government of Mr. Duplessis in Quebec and the government of Mr. Drew in Ontario had both said categorically that they would not support a hospital insurance plan. And the only two provinces that had hospital insurance plans were Saskatchewan and British Columbia. And it should be to the everlasting credit, and I think sufficient credit has not been given, to the member for, the Right Honourable Member for Prince Albert, that when he took office in 1957, he kept the commitment which he had made to the public in the general election of that year to remove that proviso, with the result that in 1958, hospital insurance and diagnostic services became available to any province which wanted to enter into the plan and pay 50% of the cost and accept the other 50% from the Government of Canada.
It was a minority government.
And of course, both Saskatchewan and British Columbia immediately became eligible, and the other provinces, one by one, fell into place. That only covered hospital insurance. When we come to medical care, the Saskatchewan government introduced medical care legislation in the fall of 1961. Matter of fact, the last piece of legislation which I introduced as Premier of that province was the Medicare legislation. And that came into effect on July the 1st, 1962. And that also was financed entirely by the provincial government out of its own limited resources. In 1964, the Royal Commission, which had been set up by the Right Honourable Member for Prince Albert, headed by Mr. Justice Emmett Hall, made its report. Now, I want to say that in my opinion, that report was the finest report on comprehensive health insurance has ever been printed in the English language.
Hear, hear.
And it's to the everlasting credit of the Right Honourable L.B. Pearson that his government brought down legislation in 1967 to implement a national Medicare program shared by the federal and provincial governments, which came into effect on the 1st of July 1967. 68. 68, yeah. Now, I enumerate this, Mr. Speaker, because those of us who were interested in this field, and those who pioneered this field, I'm not talking about politicians so much, I'm talking about doctors and hospital administrators and sociologists, and people who were interested in the wide scope of the health program, all reminded the public from time to time that comprehensive health care would come in two phases. That phase number one was the task of removing the financial barrier between those who rendered health services and those who received health services. And that's an important phase, because as long as that barrier was there were people who could not get health services. No matter how deserving, no matter how desperate their circumstances, they could not get those services. And therefore, health services had a price tag. And it was important to remove that barrier. But at the same time, it was pointed out to the people of Canada that removing the financial barrier was only a part of the program. That the much more difficult part of a health care program was to reorganize and change the entire delivery system. To move from a program which emphasized curative medicine over to a system which emphasized preventive medicine. Recognizing that the most important thing is to keep people well, rather than merely patching people up after they're desperately ill. And the member for Lambton Kent made a very excellent summary of what's entailed in that. The periodic checkups for health care, watching people's weight, X-rays, blood tests, urinalyses, checking heart conditions. All of those things that make it possible by prescribing proper diet, by taking proper preventive measures, by sometimes preventive surgery, saving people pain and suffering later on, and also saving great amounts of money. I'm always rather surprised when I come across instances of where governments say that Medicare and hospital insurance are costing us a lot of money and we've got to cut back the cost. And we cut back the cost by putting on deterrent fees. Mr. Speaker, the answer doesn't lie in putting on deterrent fees, which are simply a tax upon the sick. The answer lies in more preventive medicine, so that less people are ill, so that less people need the care. By what the member for Lambton Kent called lifestyle therapy, of helping people to eat properly, the proper foods and the proper amounts to take care of their health. The opportunity to have come before medical clinics periodically, every 12 months, and with children or very old people more frequently, so as to help them and maintain a high standard of good health. Now, what worries me about this legislation is that there's no recognition of the fact, first of all, that we haven't even completed phase one. Because when this legislation for Medicare was before the House in 1967, sponsored by the President of the Privy Council, who was then Minister of Health, we in the New Democratic Party argued for an amendment which would give the Cabinet the power at any time to add additional services to the Medicare and the diagnostic services now provided. And that was accepted by the Minister of Health of that day. But we've added no services at all. We've done nothing about free prescription drugs, particularly for people suffering from such things as diabetes and other expensive drugs. We've done nothing at all about hearing aids or glasses for people who are not able to supply themselves with those services. Nothing about prosthetic appliances, crutches, wheelchairs. All of these things, which are in some other countries, are part of their comprehensive health program. We haven't done it yet. We haven't moved at all since 1967 in extending the field of health care. And we haven't moved at all into phase two, at least very little. I think 3 provinces have set up a few community health clinics, which are acting as pilot projects, and they're doing very well. And they are demonstrating admirably that a program of preventive medicine can have a profound effect, not only in improving the health of the community, but in lowering the costs of providing hospital and medical care. And if instead of reducing the amount of money we're going to give the provinces, what we ought to be doing is saying to the provinces, we will give you very large sums of money to help set up community health clinics, or if the community doesn't want to set up a health clinic, make money available either on a loan or a grant basis or a combination of both to groups of doctors who will operate as clinics. Because the day of the doctor by himself with a little black bag is as out of date as imagining a motor mechanic going around with a bag of tools fixing people's cars. The clinic is the place where people can have their illnesses properly diagnosed and proper treatment prescribed and proper services rendered. And we haven't been doing this. So that while we have done a great deal in this country, and I want to say, Mr. Speaker, that I think Canada can be proud of what it's done in both health insurance and Medicare. It's true we're not as advanced as some of the countries of Europe who've been pioneering this field for several decades. But when you compare our situation with the United States, where they haven't got a plan at all, with all their wealth and all their power, the Canadian people can be congratulated. And the governments of this country, some of whom were very slow and reluctant, but they can be congratulated in that we've gone as far as we can. But it is dangerous to assume, as this legislation does, that the job is finished, when as a matter of fact we have just made a very good beginning, and that's all. So that instead of cancelling the Health Resources Fund and saying, well, it's all over, we've done that job, we should be recognizing that there's a tremendous task still confronting us if we are going to give to the people of Canada the health services which they need and to which they're entitled in a country with the resources we have, with the billions of dollars we spend on much less important matters. Mr. Speaker, we ought at this time Rather than reducing the amount of money for health care, we ought to be expanding it so as to provide the kind of preventive care that will enable our children and their children to live much healthier and more productive lives. And my third criticism of this legislation, Mr. Speaker, is that it indicates a deplorable standard of priorities. The ministers of health said that the government had to use her own words, had to apply a major traumatic restraint on its expenditures. And I don't quarrel with that. And I think of all the Auditor General's reports of the ports we built, to which have never put a ship, of the buildings that have been put up or leased, which has never been used, of the several million cubic feet of property and office buildings we have that are not occupied. Of course, there's a lot of waste and extravagance that needs to be cut down. But if there had to be reductions, why choose such an important thing as health services? When I look at what the government, can find money for, yesterday the Minister of
Chairman of the Board of
the
Economic
chairman,
Development,
I never can get this mouthful,
of
the chairman of the Board of Economic Development, Minister of Economic Development. That's a real mouthful. And he announced yesterday that the government is going to hand out $235 million to the pulp and paper industry, which over the last year has had an increase in its profits of 150%. Profits which have gone up from $160 million to $379 million in a 12-month period. Now, in my constituency, we have pulp and paper mills. It's a very important industry. Of course, British Columbia will not get very much of this money. Most of the money will go to central Canada, where they've got a lot of outworn, obsolete mills, and our share will be very small. But I want to point out how almost obscene it is for a government to talk about $235 million to an industry that is making more profit now than ever did in its history, and at the same time coming to this House and saying, we want to take $80 million back from the provinces which we promised them in 1966 we would pay to them if they came into Medicare. Surely, if ever there was an indication of a government having a distorted sense of values, this is it. This is it. Because after all, Mr. Speaker, the measure of a government's worth is not just in the gross national product, not just in the international balance of payments. It's not just in the amount of our gold reserve. Surely the worth of a government in the main is what it does for its people, the extent to which it improves the quality of their lives, improves their health care, gives them a greater measure of security, gives them a greater standard of moral values. That's what makes a nation great. Instead of this government recognizing that fact, it comes before the House and asks us to vote to cancel out a health resources fund designed to provide facilities to improve the health of the Canadian people, at the same time that they can hand out $235 million to an industry which has money running out of its ears. I say that as far as I am concerned, Mr. Speaker, and as far as the members of New Democratic Party are concerned, we will not agree to this legislation and what it represents.